Hello everyone, welcome back to my channel, Fetal Insights. If you're new to this channel, we discuss, share, and advocate for best modern practices in pregnancy management. In this era where technology has saturated the world, even pregnancy is not immune to technology. Today we are going to carry over from the previous discussion of fetal assessment, and we are going to discuss about normal fetal growth scan. Of course, after fetal assessment, you either have a normal fetal growth scan report or a complicated report depending with assessment. However, today we are going to take the route of a normal fetal growth scan report. What would have been assessed to come up with a normal fetal growth scan? As I discussed previously about how we assess the baby and the parameters we take note of, still today I'm just endorsing on those parameters. So firstly, I've recommended that we collect history and proper history taking, also appropriate history taking, that is mother's condition, mother's biographical data, previous history, and previous and also current maternal conditions, as well as the last normal menstrual period date. That is also crucial in managing the current pregnancy. Also, history of any fetal abnormalities, defects, or complications. So we start by checking fetal viability. We have to know if the baby is alive, and we do that by checking the fetal heart rate. We say the fetal heart rate is normal according to gestation. That is, if in first trimester, most probably this baby has got a higher fetal heart rate or a faster fetal heart rate, and in second trimester to around term, this baby has got a normal fetal heart rate of 120 beats per minute to 160. And you'd also find that in labor, this fetal heart rate will be a bit slower sometimes because of the pressures of labor. However, if it's really below normal, it might indicate that this baby has got fetal distress. In a normal fetal growth scan, it means the fetal heart rate is within normal ranges according to that gestation. We also check fetal position. The normal fetal position is cephalic position, where the head will be down. And if the baby is in breech or in oblique or transverse lie, it means that this baby is not lying in normal position. However, we are looking at a position when the head is down, cephalic position. This means that this baby is in normal pregnancy position. And then we check the fluid covering the baby, the amniotic fluid. This amniotic fluid also ranges according to gestation. Normal fluid for gestational age would indicate that this baby has got good or is in good fetal health. Large amounts means this baby might have some defects as well. If the amount of fluid is a bit lower, it might also mean that this baby has got some fetal defects. It also means that this baby is not well, or that the waters have actually came out before term. This might also lead to premature delivery. So it's a whole lot to understand about the amniotic fluid, and it's also a shock absorber, and it also helps even in the well-being of the fetus, the environment. So if these waters are not adequate, they affect fetal growth. Sometimes if the fetus squashes, it would actually result in fetal defects, clubfoot, or many more. However, let's take note that the fluid should be within normal ranges. And then we also check the placenta position, which should be up or lateral or anyway besides the birth canal. The placenta should not close the birth canal. It leads, firstly, And obviously, it means that the baby can no longer come out because the birth canal has been closed. Secondly, during labor, when the birth canal will be opening, it means that this placenta can lead to severe bleeding. This is why we also encourage women to have ultrasound scans for assessment, also to check the baby, to know what's really happening within, and to prepare for delivery plan to prevent some complications. And then we check for estimated fetal weight, which usually comes through some parameters we measure, and we calculate, the machine calculates if this baby is growing normally. The estimated fetal weight is also determined by the estimated date of delivery as well as the last normal menstrual period, or it's also determined by maternal conditions. If mom is okay, it means that this baby is also growing well. And it also depends by the fetal condition. Sometimes the baby will be ill health and this baby might not grow as expected. And then we also go on to check for fetal Dopplers, that is checking how blood is circulating in fetal organs, that is the liver, the brain, and also the umbilical arteries. They would determine fetal condition. And also we check maternal condition. Some of the maternal conditions might affect how the baby grows in utero, and might also affect or the fetal condition, and as well as the head to toe assessment. If baby shows that is normal, has no abnormalities, defects, or any problem, this calls for a normal fetal growth conclusion. So normal fetal growth scan is determined by everything being normal. The assessment is normal, the fetal Dopplers are normal, head to toe assessment is normal, baby's condition with utero by just visualizing is normal. That's the normal fetal growth scan. For more content, like, share, subscribe, and comment. Thank you.